Hi, I'm Brian Propp. How are you doing today?
Dr. Montico, doing well, thank you.
What's your role here at the center?
Well, as a MAPS physician, I've been trained with the Medical Academy of Pediatric Special Needs, and this is an organization that has been formed to work with doctors to train us to be more fluent with children with special needs. In particular, what MAPS physicians will do is we really partner with parents. As I said previously, autism is a multifactorial, multi-organ system dysfunction, of which traditional medicine is still considering autism mostly a behavioral problem. We find children with autism have issues with detoxification, immune system, GI system, of course, brain dysfunction as well. So my role is to open parents' eyes to that, partner with them so they can better understand a much more widespread, holistic, if you will, approach to caring for their child. So MAPS physicians differ greatly from traditional doctors who haven't gotten this training because this is what we've been trained to do, work with the parents, almost as if to help them with their roadmap. But as I tell parents all the time, if we've seen one child with autism, we've seen one child with autism, meaning they're all so very different. I think long ago, the treatment along these lines for autistic kids was very protocol, A, B, C, D, E, F, G, very linear, but that looks very much like traditional medicine. We try to treat a very grassroots, or use the analogy of a tree. We don't want to be way out on the limb, we want to treat from the roots up. But the parents have to learn the different dysfunctions, organ system problems, what have you, and that's our job to teach them that, so they can be aware and be observers of their children's behaviors that might be giving us clues as to what might be going on.
Well, you probably see a lot of parents that need the help.
Absolutely. The reason we suggest people see a MAPS physician is I use the analogy of looking at a problem through a different set of glasses. It doesn't mean your pediatrician or your traditional medicine doctor doesn't know how to care for your child in some regards. You would never go to a primary care physician to have an open heart surgery, nor would you go to your primary care physician for this type of specialty care, which is specialty care of children with special needs, specifically autism. So as I talk to parents about treating their child, I explain to them that autism is a word, a label, and there's no way to cure a word or a label. But just like in traditional medicine, we're trying to cure what's causing the disease. That's what kind of approach we're trying to take as MAPS physicians. Take away what's bothering the child, give the child more of what they need, and try to break the vicious cycles that are going on in them. And that's what we learn as MAPS physicians.
Nice.
So again, in regards to hyperbarics, we do know there's a brain dysfunction aspect of autism, so we certainly hope that hyperbarics can support that aspect. And as I mentioned as well, the immune dysfunction, we can have positive immune factors when it comes to hyperbarics. In terms of parents getting to know us and getting a hold of us, I always ask parents to start with TACA, which is a grassroots effort to support parents. But of course, MAPS has a website that can direct parents towards doctors who've been trained through MAPS in their geography.
What does TACA mean?
TACA stands for Talk About Curing Autism. So it's a nonprofit organization. It's really run mostly by volunteers and in many different communities across the United States. The concern I have is that we're seeing chronic disease on the rise, not only autism, autoimmune diseases, cancer, allergies, asthma, and it's really an environmental problem. So we hope by raising awareness to autism and the fact that it's a multi-organ, multi-system disease, that other patients and families realize that while their loved one may not have autism, they may have a lot of the similar problems that can benefit from this kind of approach.
This is pretty interesting.
It is interesting, and what we hope that people take away from it is there is different approaches out there, and they can be used in collaboration. It's not an either or, we like to say it's an and. So we just hope people kind of review this approach and see if it wouldn't help their loved one.
That's right.